So just how did Virginia Mason Medical Center use Carrier Ethernet to bridge its hundreds of square miles of catchment area?
The mobile vans that go to the various clinics, they actually capture the information, and then they then transmit that either to a local service in some cases, and then send that across the network to a repository where the actual images are saved.
I can check the images while the patient is on the table in case we need to do additional images, in case there's a life-threatening or other finding, that we can then call the physician and get the appropriate treatment for the patient as soon as possible.
It cuts down on calling patients back for additional pictures, because while the patient is here, we can check with the radiologist and see if they need anything more before we get them off the table, so it's much more efficient for us and for the patients.
Certainly the filmless situation that we have now with a high-speed transfer of images, it makes my job a whole lot easier, and I think it helps the patient in the long run.
With the Carrier Ethernet product, it finally had a cost metric that made sense for us. We could actually provide that type of service, and it was something that was clearly not only affordable but reasonable and really cost effective for both the enterprise and for our patients. The Carrier Ethernet really provides us just the kind of the avenue to help us grow our environment, especially for our satellite clinics, because it allows us to provide better technology. Like I said, just in the radiology realm, going from the 4 to 16 to potentially 64 slice CT. It also allows us to do innovation, to provide better applications and healthcare at the edges in terms of our clinics, and provide that type of service.
In this case, I went all the way from, I think there's a little bit of blood here, to chemotherapy in about 2.5 days.
So Virginia Mason Medical Center finds that Carrier Ethernet, which enables remote diagnosis, is literally a life-saving technology.